Hello, and welcome to Aging Out Loud, the official podcast of NYC Aging. I'm your host, Lorraine Cortés Vázquez, Commissioner of the New York City Department for the Aging. This is where we talk about the experiences of getting older in New York, without the stereotypes, without the limits, and definitely we don't whisper the word aging. My guest today is someone that I met over a year ago.
Can you believe it's been that long?
Oh, it's been over a year ago in France, Cannes, France, which is not a bad place to meet. Dr. Kathleen Léger.
Léger or Léger, whichever.
So she's a triple board certified physician in internal medicine, nephrology, and critical care. She's also the founder of Jolivet Longevity, a practice dedicated to optimizing health span through personalization, evidence-based approaches to aging. Right up our alley, so I can't wait till you tell us more about this. She's done global work in Rwanda, Uganda, Haiti, and is currently advancing her training in functional and anti-aging medicine.
Thank you for having me. So anti-aging, I don't think that's the right term. We've discussed this previously.
Yeah.
Right? It's about, because we're all going to age regardless, right? It's about how you're aging. And I think we're going to get a little bit into that.
So, you've built your whole career around caring for people, some in the most critical moments of their lives. What does healthy aging mean to you? And how is it that your area of the medical field defines it and is redefining it?
All right. So I think there are several components when it comes to healthy aging that I personally have established. So the first is one that we're all familiar with, right? Lifestyle choices. So when we're talking about lifestyle choices, we're typically talking about diet, exercise, work-life balance, right? But there are some other components that I think need to be more focused on. So the next one would probably be mental health. So there is currently a big movement towards promoting mental health and destigmatizing mental illness. And I think that's very beautiful, and I think we should continue to do that. But there are two other components I want to bring your attention to. So one is community, extremely important with healthy aging. So we have these blue zones, right, in the world. These are places like Okinawa in Japan, the Mediterranean. These people live very long lives. And the way they do it, it's not just about lifestyle. It's not about just diet and exercise. It's about community. They have a huge community. They're constantly there for each other. And the final component, I would say is probably the most important one, is purpose. So there is a term in Japanese called ikigai, and it kind of speaks to that. So purpose could be anything. It could be what you do for a living. It could be something you volunteer to do. It could be spirituality. Essentially, it's something that's bigger than you. And in turn, it actually helps promote all of the other components. If you have purpose, you're going to be interested in maintaining your health and making good lifestyle choices. It's actually going to help with mental health. When you have purpose, it could pull you out of the depths of depression because, like I said, it's outside of yourself. And then finally, community. If you have purpose, it's usually to benefit your fellow man. And in turn, you also kind of connect with people who have a similar purpose.
It's interesting that you talk about community and purpose. In our field, right, and mental health, we knew early on, and it definitely was highlighted for us during the pandemic, that we needed to expand our mental health, geriatric mental health.
Right.
Very limited practice, not as widespread as it should be. And one of the ways we kind of got around to bringing it to more people was creating a hub and spoke model. We will have the mental health clinic and the certified clinicians, but then we would have workers. Rather than have people come into them, we go out to satellites. The impact of social isolation is devastating for all of us. We found that during COVID, right? What we've found out also that for older adults, it has a health implication. Some people say that's as bad as smoking 15 cigarettes a day.
It is, absolutely.
So community and purpose is so essential for healthy living. But one of the things I wanted to talk about when you talk about community health initiatives, you've worked in some fabulous places in the world. Uganda, Rwanda, Haiti. My heart breaks out to where Haiti is going right now. How is aging in those worlds, and how did they shape your thinking about aging?
Oh, man. I mean, the experience that I had in these places was extremely beautiful. In Haiti, I was there, the last time I was there was just after the earthquake, right? And at the time I was working at a pediatric hospital, but there was something very interesting about what I saw. So first of all, these are very low resource places, probably except for Rwanda. Rwanda is doing a little bit better. But Haiti, you had people who were limbless taking their children to the hospital. But they weren't alone. The entire family was involved. Okay. And then in Uganda, resource poor hospital, don't have all the medications available. They certainly don't have food to offer the patients. So families took that responsibility. Family, friends, their neighbors, the community was involved in taking care of these patients. And then finally in Rwanda, Rwanda was building governmental programs actually to help provide healthcare to their most vulnerable. So there are so many different components in place, right? It's not just the patient and the doctor, it's the people around that patient. It's healthcare policies, right? It's the government. All of these things are involved. And it does contribute to how well you age because in order to stay healthy, all of these things are important.
You keep talking about family. Caregiving is a big role area for us, and it's a growing area, right? We have more and more individuals, you know, your generation are now becoming caregivers earlier than what was normally expected. I'm an older caregiver for an older woman, So do you see any connection between longevity and caregiving or caregiving in those countries where you worked and those distinctions?
So, I mean, older patients, right, in these locations, they have the community to care for them. I think that's something we're lacking in big cities like New York City. Unfortunately, that's something that needs to be worked on. There's not much of a sense of community here. And I know you're implementing great programs to kind of help bridge that gap. So when it comes to longevity interventions, I would say it goes back to seeing someone before you're sick. I think that's a specific culture that I think needs to change. I think we live in a society where people wait until they're sick in order before they actually see a healthcare professional. And I think that's something that's extremely harmful. If you develop a relationship with your healthcare providers, people in your community that are going to help keep you healthy sooner, you develop a relationship with these people. And I think that's how you build the community around you. So that way, when you are elderly, there are things in place to help promote longevity, healthcare.
It's interesting because I think about you just made me think about it's taken us a long time to go to this notion of primary care doctor. Before, when I was young, it was your family doctor, but that was the only doctor, right?
Yeah.
And then you went to specialists. So then there's a movement now to going back to your primary care. Um, Tell me, and I was intrigued and got into that train of thought because of your statement that to see your doctor before you need to see your doctor, right?
Yeah.
Culturally, do you see distinctions or what kind of interventions or education can we do so that that's a very high level, uh, high economic value. People with high economic means value. I don't know that other people see that.
Right.
So, what is the bridge or the education or some of the practices that we should put in place to encourage people to see him before you need him, kind of thing?
Right. I mean, honestly, that's a loaded question, right? kind of difficult to answer because the healthcare system is overwhelmed. I did my training in internal medicine. I did rotations in primary care, and doctors are overwhelmed. But I think the reason why they're overwhelmed is, like I said, people are coming to them when they're already sick. So part of, how you change that culture, I think, is education. Okay. So I'll give you an example. I had a patient in the ICU recently who had diabetes, was diagnosed with diabetes when she was 17. So now here she is at 24. Her diabetes is pretty advanced to the point where she had extreme insulin resistance and developed the production of acid in her blood. Okay, so just to kind of keep things simple, acid in the blood means your diabetes is so bad, your body's not even responding to the insulin that you're making. So she ended up in the hospital, in the ICU. And, I asked her, you've had this disease now for 7 years, right? Probably longer. You were diagnosed 7 years ago. Do you even know how diabetes works? What is diabetes? And she was not able to explain it to me. And in my opinion, the patient that does well is someone who's educated on what ails them. So I'm not asking patients to have the training that I have. I'm not saying that. I'm just saying that if you, for instance, see a loved one who is suffering from a chronic illness, chances are you might be at risk for that chronic illness. So before you develop that illness, it might be a good idea for you to see a healthcare professional to, one, learn a little bit about what the risks are of you contracting that illness and what to do about it.
Yeah. One of the things that we try to strive for is the partnership between the service network, ourselves, Department for the Aging, the policy agency, and the medical profession, precisely for what you're talking about. Have you seen any models between where you can do that public education and get people, to get to the supports they need, particularly, like, certain communities have a high propensity for diabetes.
Right.
Like, what are some of the models that you have seen that may be effective to communicate that, that see him before he sees you,
Yeah,
kind of thing?
exactly. I mean, I think there are a lot of events and programs that at least get you plugged in. So I've seen events at local churches. I've seen events at community centers. I've actually participated in some of these events where, you might have a group of patients. It could be like a carnival. I've actually done that in upstate New York, where I was going to school for a medical school, where I volunteered to check someone's blood pressure. I remember actually finding someone who I sent to the hospital because they had very high blood pressures to the point where they are at risk of having a stroke. So things like that. So now, unfortunately,
Intervention,
early intervention.
non-traditional interventions.
Yeah, and just having a conversation with people that you meet at these events, and talking about, what's your family history, what are some conditions that your family suffers from. That can kind of give you an idea and give you the ability to speak with that person and say, hey, maybe you should see someone sooner before these things develop.
What was your motivation to get into? Here you are,
Yeah.
triple certified. What made you decide that longevity was the arena that you wanted to specify? And also, the one before that one is, what prompted you to become a doctor?
Oh, okay. So I'm going to try to make a very long story condensed, okay? So, all jokes aside, but kind of joking, I come from two immigrant parents from Haiti, and they basically did not give me an option. I was very good with math and science, and they're like, "Well, you're going to be a doctor." And that was essentially it. But, I do think, I do believe.
Glad you're so compliant.
Yes, I do believe everything happens for a reason, and it was my calling. So following up to that, I was a young athlete. I was a ballet dancer and I was on a martial arts team. And I was always fascinated by what the body was capable of, the human body was capable of. It was like, well, a month ago I couldn't do this and now I could do that. So kind of pushing the limits of what your body is able to do was very interesting to me. So fast forward, I'm in medical school and I'm very excited. The issue was with the training in Western medicine. You do get wonderful training. They teach you about physiology and how the body works. And then they teach you about pathophysiology, which is what happens when things go wrong within the body. But there's a very important component that we miss today in our medical education is how to prevent illness, keep the body healthy, and prevent illness. And that struck me during my training. So fast forward to the end of my internal medicine residency, I knew that primary care was something that called to me, but I didn't want to do it because I knew what the situation would be. I'd be seeing patients when they were already sick, which is fine because I ended up being an ICU doctor and a kidney doctor. I mean, if you need me, you're already pretty sick, right? So it's not that I was, fearing having to take care of people who were really already sick. I just felt like I still had a lot to learn. I ended up doing 2 fellowships, one in nephrology and one in critical care. And the reason I chose those 2 specialties, even though it didn't really totally align with the whole preventative care piece, is because I wanted to learn more. I like to say that specifically nephrology is like medicine on steroids. You really have to understand physiology and pathophysiology in order to understand how the kidneys work. And even to this day, we're not totally 100% clear on all the things that the kidneys do. So being on the critical care side of things, which is what I mostly do, and then I started these practices on the side. So I'm working as a longevity doctor in Jolivet Longevity. I'm also working at Extension Health, which is a major regenerative medicine practice in Manhattan. So doing these fellowships, I actually found my purpose because what I was seeing in the ICU and what I continue to see today are people who are at the end stage of their chronic illness. And unfortunately, many don't understand what got them there. And many sought help way too late. So I wanted to be at the other end of that and I became very passionate about it. And that's where we are today.
So the lesson for me in this conversation, thank you. The lesson for me is that we have some mandates that our older adult centers have to have a relationship with with the health practitioner or operation. Maybe what we can start looking at also is I don't know if we want to mandate this, but have some real strong incentives for people who do a lot of that early preventative conversation and education rather than just the caring one, having the health practice there should they need the help, but basically do it as a preventive educational process.
Absolutely.
Yeah, we know that, it's funny because we know that instinctively and we know that from a policy perspective. That was the implementation of them. So thank you for re-stimulating that thought in us. Okay.
Of course. No, of course. I mean, I think that's the culture, right? The culture, I think, needs to change. I mean, in my training, they taught us once you turn 30, you probably should be seeing someone annually. That just doesn't happen, though.
No,
Yeah.
because most protocols or things are not approved till you're 40. I mean, how long did it take before mammograms to be allowed for women who are 40 if you had a pre-existing condition in your family, right?
Yeah.
But so the protocol is still 50.
Yeah.
But that condition has to be there for the insurance to allow it at 40.
I mean, and let me mention hormones, women's hormones. I mean, the FDA just took off the black box, saying that women's hormones increase the risk for cancer. I mean, specifically women. I think women have gotten gypped a lot in healthcare, for sure.
Well, not only in healthcare.
That's true.
So,
Amen to that.
a little lightning round for you. One word you would use to describe the future of aging.
Bright.
Yeah.
Very bright.
Why?
I think we're living in a very interesting time because they care about this a lot more than they used to, right? You see it everywhere, right? We are consuming media that's talking about anti-aging to a certain extent, a little malignant.
Yeah. It's
Yeah, it's ageist. It's a little bit to our detriment, but at least it's bringing awareness and care
I think
about health.
the numbers are forcing the conversation
Oh, yeah.
rather than the actual value and intent. But the numbers are forcing the conversation. I mean, when you're in a city like New York, when you're 20% inching to 25% of a population, it makes somebody's eyes go up and say, oops, wait, there's something here that we need to be tending to. As fortunate for those of us who live in New York City, we have a very strong, robust care support for older adults in the community. A neighborhood that you would say that people, and your favorite New York City neighborhood where people can age well.
Honestly, I would say Brooklyn. I feel like there's a strong sense. I mean, maybe it's because I worked in Brooklyn. There is a strong sense of community there, even to this day. I'm one of those physicians occasionally, if I feel like someone's not really getting the care that they need, I probably shouldn't do this. I'll actually give out my personal number. And I stay in touch with some of my patients. And they update me on things. There's a strong sense of community. I think, then they'll talk about other family members, and it's really beautiful. I mean, I grew up in Queens, but I've never worked in Queens. So I have to shout out Queens a little bit, but
East too has a sense of community. Even with the gentrification in both those boroughs, there's still a strong neighborhood identification.
oh yeah.
People will say, I'm from Flatbush. And some people say I'm from Brooklyn, but most people say I'm from Flatbush. I'm from Crown
Yeah.
Heights.
Yeah.
I'm from Corona. I'm from Jackson Heights.
Yeah,
There is a
exactly.
real sense of that neighborhood in those boroughs. What gives you hope right now?
I mean, many things, to be honest. I think that this is going to be democratized. I have to admit right now, it's, as you mentioned, it's the super wealthy that are getting this care. But I think eventually it's going to spread, this awareness. And in the long run, it's going to be beneficial. It's going to cut down healthcare costs if people are seeking care a lot earlier.
Right.
So I think if there's a shift in the culture, and I think it's happening, I think that's where we're
Yeah.
headed.
And I think you're right. And I think the more that longevity doctors see this large population and this large possibility and potential, that will start bringing the two together
Mm-hmm.
and democratizing it as you and
Dr. Lou.
like Dr. Lou allow me to keep saying. I want to democratize longevity.
Yes.
So thank you both for letting me, into that little sphere and talk about that. So thank you so much
Oh, thank you for having me. This was
for
so much.
sharing your expertise and your passion and your vision. And I loved your family story. I could just see your parents saying, you have no choice.
Yeah, pretty much. That Disneyland ride with the blood cells? It's an old one, Universal Studios. They had me ride that at six times. So
Yeah, right.
there you go.
No influence there.
Yeah.
So thank you for your a constant commitment and your looking at ways for us to renew this relationship between healthy aging and longevity. And to our listeners, aging in New York isn't just about growing older. It's about growing bolder. It's about thriving together. So thank you. You can find out about Aging Out Loud wherever you get your podcasts. To learn more about NYC Aging, visit nycaging.gov/aging. Bye-bye. Thank you again.
Bye. Thank you.